So that's a big that's a big group of people that you want to kind of cater to. And Instagram, I will say, is probably the best way to reach these patients. Some people talk about Snapchat. I think those are the younger, and maybe lips, like the Kylie Jenner population. But I think for the brow lift, I think everybody likes to look more rejuvenated with just one unit underneath each eyebrow. The bunny lines over here, crow's feet. So masseter injection is so huge. I had my own masseters injected. I re-injected them 2 days ago, but it really does slim the face. Now, is there a chance where you're slimming the face and things kind of droop a little bit more? It's a possibility. So make sure when you feel for their masseters, you make sure they don't have a lot of laxity, because they could potentially kind of bring down a little bit more of the face, and you don't want kind of that, that dragging, that sagging of the mid-face. And we could talk about jaw recontouring and lifting that up, and then threads in the future. Lip lines we can do with Botox. Those are the smoker lines, the gummy smile, the jowls, the chin wrinkles, and the neck cord lines. Okay, so go to the next one. So before we inject any neurotoxin, you have to get an H&P. Okay, I was at a charity event recently where the neurologist was like, "Oh, I never do an H&P." It could only protect yourself to do an H&P, because if they have, God forbid, myasthenia gravis or Eden-Lambert or something where you're unaware, okay? There was a recent litigation suit where a med spa in Oklahoma was sued because they injected Restylane and the patient had some scarring. Now, I don't know much about that, but if you have in your consent form possible scarring, possible granuloma formation, possible, asymmetry, lumpiness, as long as that is in your consent, you should be covered. All right. The good news is that a lot of these things are reversible, and when I say reversible, if you're losing hyaluronic acid, and they're not permanent. So that's the good thing. Prior allergic reaction is important. That's very rare to have an allergic reaction to botulinum. What we typically see, and it's very rare, is someone will say, I've been getting it for years, and then the last time I got it, I felt like it didn't work, right? So that's when you switch to something else like Dysport or Xeomin, right? Because it's more purified, less protein, and so forth. Active infection and inflammation. I probably would not inject if they have active inflammation over the area. So these are all kind of very intuitive things. Keloid scars, so that, I don't know if that's an actual contraindication or if that's a relative, if it's absolute versus relative contraindication, because keloids are although they can be common, after incisions and things like that, if you're just using a needle and in the face, keloid production is it's very rare. But that being said, you want to ask the patient if they have a history of keloids. That may not be, you may not want to inject that person as one of your first-time patients. Pregnancy or breastfeeding. Now, there are certainly no studies, because no one's going to do studies on pregnant or lactating women to show the adverse effects, but from a legal standpoint, it's just best if you stay away from it. Now, do you have to get a urine HCG on every patient that comes in? No. On our consent forms, and after this course, we're going to send you for something. Some of you already have our consent forms already. It just asks, are you potentially pregnant or are you lactating? And if you say no, that will cover you. Okay, so that's very important.
Every time they come in for an injection, they have to sign?
I do. It will only protect you if you do it every single time. Okay. Yeah. Relative contraindications, we talked a little bit about myasthenia gravis, or anything, any kind of autoimmune disorder where you're going to have